I'm Bryce Barfus with Summit Dental Care, and I'd like to talk to you about good foods, bad foods, and pH and the role pH plays in our dental oral health. So good nutrition plays a vital role in dental health, and I'd like to talk to you about that. It's very basic, but it's something that we talk about all the time. A lot of times patients will come in and they'll ask, why do I have all this dental decay? And there's two reasons. One reason is diet, and the other reason is poor oral hygiene. So we're going to talk about diet. There's good foods, and then there's bad foods. So there's good foods that we can have, right? And it's pretty obvious. The first one is dairy products. So you have milk and you have cheese and you have yogurt. It has calcium and it has phosphorus in there. Our teeth are made up of calcium and phosphate, so it's one of the best things that we can intake with food for our dental oral health. There's fruits and vegetables. Fruits and vegetables, obviously, they're healthy. They have the vitamins and the minerals that we need for overall body health. A lot of times what we tell patients is what we put into our mouth is the gateway to the rest of the body. So if you have good health in the mouth and good food, then that's going to translate to the rest of the body. Good health here translates good health in the gut. Another good food is lean protein. There's fish, there's chicken, and then there's eggs. Those products have phosphorus in them, and that's something that adds to remineralization of the teeth and the health of the teeth. Then there's nuts and seeds. Nuts and seeds have a lot of minerals in them. They have calcium and they have vitamin D in there that can help with our dental health. We need to make sure we're drinking plenty of water. Now there's a lot of different things that are out there in the media, but essentially it's 8 glasses of water a day that we need to intake. And water helps to lubricate our teeth. It helps to wash off the food and the debris that's in there. It also helps to raise the pH. Let's talk about bad foods that relate to your dental health. The first one is sugary or sticky foods. Now this is the worst one, along with pop, because what it does is the sticky foods and the sugary foods, they stick to the teeth and they have high content of sugar. Now sometimes people say, well, the sugar is the bad thing or the bacteria is the bad thing, but it's actually the two combined. So sugar combines with the bacteria and it produces acid. Now this is dentistry 101, but essentially what happens is you have bad bacteria and you have good bacteria in the mouth. The bacteria, they eat the refined sugars, they metabolize those sugars, and then their byproducts are acidic. So what we tell little kids is you have bugs that are in the mouth, they eat the refined sugars, the snacks, the sugary things that are out there that you eat, and they have to go to the bathroom somewhere, so they go to the bathroom on the teeth. Now we call it bug poop, and that's what we tell little kids. Super simplified version, but what we talk to adults about is, yes, you have these bad bacteria, you have these refined sugars, the bacteria eat the refined sugars, they metabolize those refined sugars, and their byproducts are acidic. That acid is what eats away at the teeth and causes decay. Then there's acidic foods and drinks. Now acidic foods can be like tomatoes, limes. Sometimes people consume a lot of those acidic foods, but then there's the drinks. You have Red Bulls, you have energy drinks, you have Gatorade, you have Pepsi, Coke, all those pops that are tasty and good and delicious, but they're acidic in nature, and that acid eats away at the teeth. Then there's starchy foods, like chips, crackers, and bread. What happens with that is you eat that, it sticks onto the teeth and creates plaque. Plaque, when we say plaque, that's a term that is all the debris that's on the teeth. So when you take your finger and you scrape your tooth and you get that fuzzy stuff right on your fingernail, that's plaque. That's what we can take off with brushing and flossing. Starchy foods can cause that plaque debris build up on the teeth. Another bad food is carbonated sugar drinks, things like Coke, Pepsi, Mountain Dew, or energy drinks. There's a lot of people drinking energy drinks now. Not only are they acidic in nature, but the sugar, the high content of sugar that's in the drinks, adds to the bacteria. The bacteria eats that sugar or consumes that sugar, and then they produce acid. So you have the acid from the drink itself, and then you have the acid from the sugar combined with the bacteria. It's a perfect storm for dental decay. So we see a lot of people come in with decay, especially with the front teeth, because they're sipping and drinking on carbonated sugar drinks all day. So the best thing to do if you're going to drink carbonated sugar drink is to drink it in one sitting. And then after you're done with that drink, you drink some water to help buffer those acids and raise that pH level back up to where it needs to be. Now let's talk about the role of pH in dental health. pH has everything to do with dental health. First I want to tell you what the pH is. There's from 0 all the way up to 8 or 9. The closer it gets to 0, the more acidic it is. The higher it goes, the more alkaline or basic it is. We want to stay at a neutral pH or around a neutral pH, which is a 7. So water, for example, is a pH of 7. The sugary drinks, the snacks that have a lot of sugar in them, those are at more of a pH of a 3 or 4. Fruits and vegetables, a lot of vegetables like broccoli can be more of a pH around a 7 or an 8, a higher alkaline or basic content. We want to consume things that are higher pH, not things that are lower pH. If you go down to a lower pH, around a pH of a 3 or 4, that's an acid, and that starts to destroy the dental enamel. And that's where we get cavities, that's where we get a lot of destruction. So if the oral environment is around a pH of a 3 or 4 constantly by sipping on soda pop that has a lot of sugar in it, or eating snacks that have a lot of sugar in it, then you're going to have a lot more dental decay. Something that helps the pH balance in the mouth is your saliva. Now sometimes people think, well, the saliva is a bad thing, but it's actually a really good thing, and it helps to protect your oral health in a big way. So one thing it does is it helps to lubricate the teeth and the tissues to have good dental health. It also helps to buffer the acid. So if you have an acid that's down at a 3 or 4, the saliva helps to buffer that to raise that pH up to a neutral level. It's important to note that saliva takes time to neutralize acids. So snacking or sipping on acidic foods and drinks throughout the day can be more detrimental than consuming them during meals. So to maintain good oral health, make sure you have good foods, not the bad foods. Make sure that you take foods in that have a higher pH, not a lower pH, and look at what you're drinking, what you're consuming, and really take a self-assessment and say, what do I need to do to make sure that my dental health is there so it translates to the rest of the systemic health. If you have any concerns about your dental oral health, then please come to Summit Dental Care. We'd love to help you. We can talk about diet, we can talk about oral hygiene. That's what we do all day, every day. We're here to help in any way that we can.